This is part of a series of exercises to help you regain some of your awareness in your breath and to learn how to breathe into all the different directions. This is going to be the lowest position, so this is going to be really learning how to connect your diaphragm and pelvic floor together. As your diaphragm contracts, it should really pull inferiorly, descend downwards, and that should help relax and lengthen your pelvic floor. So your pelvic floor should come down. A lot of people lose access to their end range strength of their diaphragm, and therefore they lose access to lengthening and relaxing their pelvic floor, and they have a tight pelvic floor and can have pelvic floor dysfunction. So what we want to be feeling as you're doing this is almost like a reverse Kegel. If anything, you should feel a little bit of pelvic floor relaxation, but you should not feel straining or pressure or like it's really challenging. It should be more challenging mentally to get it there. If you're trying really hard, then we're trying too hard. Over time, if you try a little bit less hard, you should feel like you can get your diaphragm and your breath down lower. And if that's not happening, we need to troubleshoot and work on some other things that might be happening there. Now, to actually know whether or not this is happening, you're going to find your pubic bone. So it's going to be lower than you usually think it is. So it's that bone right straight below your belly button. And then you're going to push on the actual bone and go right above that and in. So kind of like right above your pubic bone and in, you should feel your pelvic floor. That is going to be literally the top of your pelvic floor. So now we are just going to do a regular breath, very quiet and very slow with our mouth closed and our nose doing the breathing. So relax, inhale, feel the movement go down into your fingers, and then exhale and relax. And we're going to do a few breaths just like that. So as you are doing this, again, you should feel like maybe your ribs are expanding, you feel some movement in your back or sides. That's fine, because as we're going down, you're getting expansion everywhere. Your lungs are getting air in, and you're also getting a little bit of an increase of intra-abdominal pressure that happens as your diaphragm descends, which is totally fine. We just want to make sure that we are able to feel that breath come all the way down into our fingers without straining and really trying to push and contract everything. And that is going to be a really great relaxation breath for your pelvic floor, but it's also going to be a really full range of motion diaphragmatic breath to get your diaphragm contracting through its full range of motion. A lot of times when people start to do this, they feel that it stutters or it's really challenging. If that's the case, just practice very slowly. Over time, it should get a little bit better, and you can actually practice holding that breath at that bottom position for a second or two, just to start to build your strength like you would in any other exercise. So as you start to do this, make sure it's not straining, we're not squeezing, we are trying to really just slowly get that breath there. It should be very relaxation breath oriented. If this position isn't working for you, you can also try in a lot of other positions, like on your back with your knees elevated, or maybe in a little bit more of a position like so, where you're seated and supported, but your fingers are going to give you a lot more awareness and feedback. So make sure that you are trying to use those, and then over time you should feel that this becomes way easier and a lot more second nature, and you might feel that your pelvic floor is also improving as well.